everybody, my name is Jeannie Rouse and I am a BSN student with Indiana State University. Today I'm doing a presentation for any pregnant women or postpartum women in regards to perinatal and postnatal depression. Just a bunch of information about that. If you can click on in the comments below, there's a pre and post test that I would like you to take before and after this seminar, and there's also a flyer listed below just in case you want to have information handed out, just in case you're going to use this information for anything. So here we go. So our learning objectives today, you should be able to explain what perinatal depression is. You should be able to list the signs and symptoms of perinatal depression. You should be able to compare and contrast baby blues and perinatal depression. You should be able to describe postpartum psychosis, and you should be able to list tips for helping to manage perinatal depression, and then you should be able to identify resources for treatment and safety measures just in case. So what is perinatal depression? Perinatal depression is a depression that occurs during or after pregnancy. Symptoms can range from mild to severe. In rare cases, symptoms are severe enough that the health of the mother and baby may be at risk. But perinatal depression can be treated, but it is a type of mood disorder that affects women during pregnancy and after childbirth. So the word perinatal refers to the time before and after the birth of a child. So it used to be called postpartum depression. So you have perinatal depression that includes depression that begins during pregnancy, and then you also have depression that begins after the baby is born for postpartum depression, but it's all kind of about the same. Mothers with perinatal depression experience feelings of extreme sadness, anxiety, fatigue that makes it difficult to carry out daily tasks. Signs and symptoms are listed here. It could be a range of things. You can have all of these symptoms, some of these symptoms, none of, like different types of symptoms. Some of them are a lot more extreme than others, like thoughts of death and suicide or thoughts of harming yourself or your baby. You could have trouble bonding. Just take a look at these symptoms here and read through them. See if you have any of them. And is perinatal or postpartum depression different than baby blues? So the baby blues is a term used to describe mild mood changes and feelings of worry, unhappiness, and exhaustion that many women sometimes experience in the first 2 weeks after having a baby. Babies require around-the-clock care, so it's normal for moms to feel tired and overwhelmed sometimes. If mood changes and feelings of anxiety or unhappiness are severe, or if they last longer than 2 weeks, you could potentially have postpartum depression. And then postpartum psychosis, it is rare. It happens up to 4 new mothers out of every 1,000 births. It usually begins in the first 2 weeks of childbirth. It is considered a medical emergency. Women who have bipolar disorder or another mental health condition, including schizoaffective disorder, have a higher risk of postpartum psychosis. Symptoms of psychosis is a lot different than postpartum depression symptoms. The psychosis symptoms are listed on the right-hand side of here. So these ones right here are the signs and symptoms of postpartum psychosis. Please read through those so you have an understanding of those. Tips to cope with postpartum depression. Create a secure attachment with your baby. The emotional bonding process between mom and the child is known as attachment. It is something that is a good relationship, and if you feel like you have a good relationship with your baby, you'll feel secure enough to develop fully with them. Hi, monkey. You can also lean on others for help and support. We are social creatures, so definitely have some positive social contacts with family members, your spouse, friends. New mothers can receive help from those around them to help with their babies. In today's world, though, new mothers often find themselves alone, exhausted, and lonely. So just remember to make relationships a priority so you don't get caught in depression. And don't keep your feelings to yourself. Definitely talk with family or friends. And then be a joiner, like seek out other women who are also in that same transition period as you. Another thing to do is take care of yourself. There's a lot of things that you can do to help relieve or avoid postpartum depression. Skip housework. Make yourself and your baby a priority. Like give permission to concentrate on you and your baby. Like, there's more to life than just a clean house. Other people can help. Just put it on the back burner. Ease back into exercise. Studies show that exercise may be just as effective as medication when it comes to treating depression. Don't overdo it. Start with a 30-minute walk each day. See how that goes and work your way up to it. Yoga is also something you can also do. You can practice mindful meditation. Don't skimp on sleep. I know a full 8 hours might seem like an unattainable luxury with a newborn, but poor sleep makes depression worse. So definitely try to get as much sleep as you can, get naps in, have your partner or family members help in the early times. Set aside quality time for yourself. Just, take some time for just you and have someone else watch the baby for an hour or two. Make meals a priority. When you're depressed, nutrition suffers, so it's really good to have good quality food so that your supply in breast milk doesn't decrease. And then get out in the sunshine if it's nice and warm out. Also make time for your relationship with your partner. Keep lines of communication open with them. Carve out couple time. Don't scapegoat. Don't just be like, I can't take care of anything with you because we have a baby now. Or don't feel frustrated towards them for not helping. They may be just as lost as you are in the new realm of babyhood. There's also screenings and treatments that providers can do. Screenings should be done at your postpartum office visits, and I know a lot of providers probably don't do them at well baby appointments, but you're also being seen by a provider. Granted, they're a pediatrician, but they can also just kind of ask you questions, or if anything, they can help get you the care that you would need. The screening that is used is called the Edinburgh Postnatal Depression Scale, and you just answer some questions about it, and then it helps the provider figure out what score you're at for your depression. But you can always call your care provider, your OB, or your midwife if you have any of the symptoms that we listed on the other slides. There are some treatment modalities that can be used, including medications and psychotherapy. The type of psychotherapy used is usually cognitive behavioral therapy or interpersonal therapy. It's just like a form of talking with a clinician, a mental health clinician. Those are great things to do. And there's also antidepressant medication that is specific for breastfeeding moms as well. These are some numbers just in case you need to contact anyone. If you are having a mental health crisis, definitely call 911 in emergency. We also have the suicide prevention hotline here if you feel like you are thinking of harming yourself or your baby. There's also a crisis text line too, just in case you don't want to call anyone. Texting can also be very helpful. It's a lot easier to get across. This website here is a behavioral health locator by state. If you are curious about trying to get treatment for mental health, this website is a good place to start. It'll help you figure out clinics in the area. Another one is just call your OB provider, whoever that is, whoever you've been seeing. Definitely keep in contact with them postpartum for a while. They are your greatest asset and resource. These are the references that I use to get my information. Thank you for watching this educational video.